So like we were just talking, I'm not gonna lie, I kind of got chills when I saw the first vaccines being packaged, then rolling out, and then showing up in Colorado. And the timeline of it all is pretty extraordinary of how this rolled out.
Huge deal. I mean, you think about where we were back in March when we were just learning about this. And back in March, it really would have been absolutely unheard of for us to have viable vaccine by the end of the year. I don't think anyone realistically thought that was possible back in March, but now here we are in December and tens of thousands are rolling out here in the state of Colorado. It's a big deal. And obviously right now it's just going to frontline healthcare workers, but that's a big deal too, because we've got to feel like they're safe in order to take care of the people who do have.
And we have talked and kind of watched the data for so long, watching for that Thanksgiving spike. And we never really quite saw it from my understanding. So what do you think was happening there?
Yeah, we've been sort of building up, waiting days and days, and now a week or so more afterwards, and sort of waiting. When are we going to see that Thanksgiving bump? And I think yesterday, really for the first time, you started to hear from the state. I've been saying this for at least a week now, but the state really sort of said, we're not seeing any sign of a significant Thanksgiving bump. Doesn't mean that people didn't get sick over Thanksgiving. Right. It just means that that dreaded bump that we would see cases start to skyrocket, and more importantly, hospitalizations start to go up, that hasn't happened. And still right now in Colorado, you're really starting to see everything start to go down, except for deaths, and there's an explanation for that. But cases, positivity, and hospitalization, all three of those are going down, and that's a really good sign that whatever happened in Thanksgiving isn't impacting us adversely right now.
And I mean, I always think about this, that this didn't just happen magically. It means that people were actually following what the guidelines were.
Yeah, there's an idea that when you have so much community attention, and this is a controversial idea. There's some people who don't believe in this at all. But there's an idea. I asked Dr. Fauci about this when I had the opportunity not too long ago, and there's just this idea that when enough people get sick and there's enough attention on the news, that people who wouldn't normally start to check themselves and not see a lot of, and they would normally be prone to sort of see a lot of people, maybe they see a bit less. And because of that, just that mental aspect really starts to change your habits. And really, there's been an acknowledgement, Anusha, of the last, that the spread in the state of Colorado, really around the country, isn't driven by the spread that you see, meaning in outward places like restaurants get a lot of attention, crowds outside get a lot of attention. Really, the spread that you're seeing primarily is inside homes and family get-togethers. And that type of get-together has really been the problem. And so that's a really hard thing to sort of regulate. And because of that, you sort of have to rely on the good graces of people. And I think what some of those health officials are now saying is the good graces of people really have made a difference and slowed the spread.
Yeah, I going back and forth with the city all the time of how are you going to regulate this? You're not regulating inside homes. And so that means some people at least were making the right decision. Yeah. Speaking of holidays, I know that we are asking politicians about their plans. After what happened with the mayor of Denver, I mean, how are people supposed to believe what they're saying at this point?
You heard the mayor was on a news conference this morning, and it was really the first time he's had one of these public updates. And really, one of the first things he did before he took questions from the press was address the clear standing elephant in the room and say, look, I know I made a mistake. I'm staying home. He was asked what he would do. He's going to stay home. I think the warning is clearly there. If you're a politician now and you travel outside of your city, you're an idiot and you deserve every single story that's coming your way. I think it can't be any more clear cut. Everybody saw what a number of politicians went through for Thanksgiving. If you're now so stupid that you're going to travel during Christmas, you deserve every single story that's coming your way.
I just remember watching the mayor explaining the decision making and then getting a photo from a viewer who spent Thanksgiving by themselves because they made that decision and going, you owe it to people.
we have to believe that in our system that the people that are making the rules are also abiding by those same rules. And I think that's why these things have been felt so acutely, because as you said, there are people that are making huge sacrifices in their personal lives and not seeing a lot of family members. They're worried about seeing family members and they don't want to put anyone else at risk. And so they're making those sacrifices, particularly right now. It's a really, really difficult time for people to do that. And then when they see other people not do that, it feels like a betrayal. I mean, quite frankly, it just feels that painful because, hey, I'm not doing this. Why aren't you doing this? And oh, by the way, you're the person that makes the rules.
Right.
Really not a great look.
You know, because we pay attention and everyone's paying attention to the numbers so much, how can we expect the vaccine rollout to start reflecting in our daily numbers and the transparency in that, just to understand what's actually happening?
Yeah, great question. The state was asked that yesterday. A lot of folks with CDPHE were asked that on a call yesterday. Really, the best thought is that we'll start to see a dent in the numbers maybe by late January or early February, primarily because by that time, not just frontline healthcare workers are going to be vaccinated, but you're going to have a lot of folks in long-term healthcare facilities who are going to be vaccinated too. And so really those folks that are potentially most prone to getting really, really sick are going to be vaccinated. And so you expect to see some sort of mark from that. That's irregardless of whether I had used that word again. I used that word irregardless a lot. And somebody got mad at me for last time. It's an actual word, by the way. I'm sorry.
Yeah. Well, I mean, I thought it was a real word.
I don't know. But like that's, I mean, once you get past those groups, you're going to start to see that. But irregardless, you're still going to see the normal fluctuations of the virus itself, because we're still not at that level really where you need to be 70% herd immunity, whether there would be people who've already gotten sick and have antibodies or people who've been vaccinated. Once you get to there, you really start to, you bring it way down. But until that point, it's still going to go and it's still going to sputter. And really, I think that's really the challenge of January for the country is going to be, we're still not vaccinated. We still don't have huge rollouts of vaccinations. We're still, like in Colorado, for example, teachers are not getting vaccinated on the front end. And so schools are going to have a huge challenge in January. I know everyone's talking a good game right now, but when it comes down to it, when teachers need to quarantine, when teachers need to start to isolate, when students need to do the same, can you keep your school open? We saw in November, didn't work really well. And the question is, can it work in January? There's lots of optimism that it can, but I've talked about this before, is what's changed now? What's changed in January that was in place in November? What's the different environment that's going to allow January to work really well when November didn't work so well? That's going to be a challenge.
Right. And I remember doing stories about how anyway, there were substitute shortages. And then if people start getting sick and you start having teachers need to step out for 2 weeks, it becomes a real problem. You know, January obviously is second semester for our schools, and some are already rolling out plans for what they want the rest of their school year to look like. You touched on this a little bit, but, you know, what are going to be their biggest challenges to figuring out how to do this safely?
It's just practical sense of being able to do this when teachers start to test positive, or when teachers are around people who test positive and they need to quarantine. Every plan, I think lots of schools found this out the hard way. Plans can look great on paper and they make a lot of sense and they seem to work. And then when you start to deal with it in the real world, and you hit the nail on the head with substitutes and other staff. Just like we had a staffing issue for hospitals, we're going to have a staffing issue in schools. And can they keep them open? I think most everyone agrees we've got to open up schools. We've got to get kids back in schools. That's the best way for them to learn. But if you don't have a plan to do that works in a practical setting, you're going to have the same result you saw back in November. And that's really going to be a problem for lots of school districts as they try to move forward. I wish them all the best of luck. I hope this works really, really well. I have a 10-year-old daughter. I want her to go back to school. But in the meantime, if it doesn't work I mean, it can work great it can look great on paper, but if it doesn't work in the real world, it's not going to.
Yeah. Yeah. Awesome. Is there anything else you wanted to add in, or are we missing anything?
Isn't it weird that I snuck into Kyle's basement?
I think it's fantastic.
I know it's
Yeah.
super weird, huh?
No. People are going to think that you're in the basement of his actual house, and that he doesn't know that you're there.
It's really weird.